Good morning. I'm Peter Kovacs. I'm the editor of The Advocate and the Times-Picayune, and we're sitting here today in the governor's office for a virtual town hall with Governor John Bel Edwards. Governor, welcome.
Thank you, Peter. It's good to be with you.
Our town hall today is brought to you by the good folks at AARP, and before we get started, we'll have a short word from them.
Hello, I'm Bobby Savoy, AARP Louisiana State President. Like you, I just want life to get back to normal. We can do this, Louisiana. With thousands of people getting the vaccine every day, we're making progress. Let's keep it up. AARP is proud to sponsor today's roundtable to help get the information we need, whether it's facts about the vaccine or how we can all safely get back to the life we want to live.
March, and I think you were fixing to get vaccinated or in the middle of getting vaccinated. I don't recall exactly.
Well, I did get vaccinated, and I was very thankful, and certainly I want to encourage everybody to make the decision that I made and to do it as soon as possible. But yes, I am fully vaccinated.
Yeah, I knew you were because we discussed it, we were both discussing our vaccination experiences. Anyhow, I think both of us probably thought we wouldn't be doing any more town halls, but here we are back again.
I don't mind doing town halls. I just wish the subject that was going to dominate the conversation wouldn't be COVID, and certainly wouldn't be something called the Delta variant.
Well, it is, unfortunately, and we got about 200 questions, and so I'll just start firing away. The first question, literally the first question, within a minute of us putting a thing online saying you could ask questions, came from Bianca of New Orleans, and this was a common question, and she says, will you give the unemployment back? I got COVID at work, and now my whole house is sick with little extra money.
Yeah, and I'm assuming she's talking about the
Supplemental,
the enhanced compensation benefits, the federal benefits, $300 per week. Those benefits end September 6th for the whole country. And September 6th was picked because at that point, schools are back in session. As you know, we go back to school much earlier. In fact, schools have already started going back into session this week. And so we were targeting early August. And then a bill passed in the legislature that afforded an additional permanent benefit increase with state benefits. The first one in I think a couple of decades, but it was premised upon having those enhanced benefits expire by the end of July 31st. I did sign that bill into law, and I will tell you, they're not going to be, the federal benefits are not going to be extended until September the 6th. The good news out there are tens of thousands of jobs that are available today. We do encourage people to reconnect with work, and of course the state benefits for those who qualify for them will remain available for the folks who apply.
Yeah, that was a compromise with Republicans in the legislature, and of course the facts on the ground were a little different when you signed that and agreed to that compromise.
I think that's fair, but again, you do have a permanent benefit increase, and the difference in the termination of the benefits is about a month. Okay. And so it was a compromise, but the legislation was passed, it's been signed, and so the enhanced federal benefits from this iteration of the act that Congress passed will not be available. If for some reason they pass another round of enhanced benefits, then that will be different.
Would be available.
Yeah.
Okay. Well, the second question, which arrived 8 minutes after we solicited questions, was about football. Yeah. And the question is from Simi in Baton Rouge. Will LSU football be at 100% capacity for the 2021 season, and will masks be required?
You know, I don't know the answer to those questions. Those are not decisions that we have to make today. You never know. The question from Simi is about the whole season. We don't know what things look like 2 weeks from now, much less 2 or 4 months from now. But what we did this week, and I'm sure we're going to get into this in more detail, is I reinstated a mask mandate that is for indoors in public spaces. And that applies K through 12. It applies for higher education, and again in all public settings. But it's indoors, and so right now I don't have any intention. I don't have any recommendation from CDC or from the Office of Public Health here in Louisiana to extend that to outdoor locations. And so I don't want to say never, because you don't take any tools off the table, because you don't know how bad things can get and what recommendations you're going to get tomorrow or next week.
Okay. So Dominic from Denham Springs says, will vaccinations be required of state employees?
Yeah. That's not under consideration unless and until the FDA grants full licensure to one or more of the COVID vaccines. I think that's going to happen relatively soon. Perhaps by Labor Day, based on some New York Times reporting that I saw last night. And then the COVID vaccine would work just like other vaccines that are currently mandatory, and there are a number of them that are on a schedule that the Department of Health keeps, and it requires those vaccinations, whether it's K through 12, higher education, and so forth, subject to whatever opt-out provisions are in current law, of course. And so it would be my expectation that once full authorization, or sometimes it's called licensure, is granted, then that vaccine will be added to the list, and then it will work just like the current mumps, measles, rubella, and other vaccines.
Yeah, okay. JS from Baton Rouge asks, what about the illegal immigrants being dropped off by the busloads in Baton Rouge? Might that be the reason for the sudden surge in COVID cases?
Well, first of all, no. The reason for the surge in COVID cases is because we didn't take full advantage of the time that we had to get enough of our population fully vaccinated. Currently, we're at about 37.1%. That's nowhere near enough. And then on top of that, you have the Delta variant, which is at least 2 times as transmissible as earlier forms of the virus, and it's more virulent as well. And it was those two things together, I think, with the weather, where this is the hottest, most humid time of the year, frequent rain and so forth, driving people indoors, where I think the virus was able to spread much more quickly. So that's why we have the surge here. And by the way, all 50 states are reporting increasing cases. Now it's much worse here than elsewhere, but only to degrees. So whether it's Florida, Arkansas, Missouri, I mean, you name it. Now it is true, and I hope we get into this more, that our case rate, our 7-day case rate, so case growth is #1 in the country. That is not a distinction we should aspire to. But the reasons for that are, as I just mentioned, and quite frankly, I've heard a little bit about some internet back and forth about immigrants being dropped off. I'm aware of a couple instances of that, and not even in Baton Rouge, but relatively small numbers in Shreveport that wasn't coordinated the way that ICE would normally coordinate that. But that is not causing the surge in Louisiana.
Okay. The next question comes from Mandy in St. Gabriel. She says, please tell us why the LSU administration refuses to mandate COVID-19 vaccinations despite the unquestionable demands of students, faculty, and staff that the vaccines be required for campus access.
Yeah. Well, it's a great question, and I think it's on a lot of people's minds in particular because in Indiana, Indiana University mandated the vaccines, and a federal district court and now the 7th Court of Appeals, U.S. Court of Appeals, has affirmed the trial court's decision that mandate is reasonable and lawful. Yeah. In Louisiana, we're taking a different approach, and actually there's some conversations happening with higher education leaders as we sit here. But the decision has been made to wait until there's full licensure, and that sort of gets us back to the conversation we had just a few moments ago as to when the COVID vaccine will be added to the schedule of mandated vaccines, again, subject to the opt-outs that are currently in law, and that's what we can expect at higher education as well. And again, that could happen as early as Labor Day, and I guess even earlier is possible. The FDA undertakes the process of reviewing all the data, visiting all the manufacturing facilities of the COVID and so forth, the vaccines, I should say, and they'll make that determination.
Okay. You know, LSU in the past decade has a history of making some bad decisions based on bad legal advice. And there are a lot of people in the law school who think they're getting bad legal advice. Are you familiar with how they're getting legal advice, and are you satisfied with that?
Well, first of all, I don't know the context of the question. Does that question relate to things that have happened over the years, or is that specifically as it relates to?
I mean, the bad legal advice in the past relates to the sexual abuses and relates to the presidential search of King Alexander. The current question, and I know there are people in law school who don't agree with the legal advice they're getting, is the legal advice they're getting that they're citing, as I understand it, is that they don't think they can legally mandate the vaccine.
Yeah. Well, first of all, I too had concerns about advice that LSU received and that they took in the past. I will point out that the King Alexander search methodology was not followed most recently.
Yes.
And I don't believe you could have had a more transparent search for president than what we just had.
That is true.
And whether that was because the legal advice changed or because my directive to them was different, one way or the other, it changed. But I don't have a problem currently with the legal advice that they're getting, whether it's from the executive council there or from any outside counsel. You know, this is not just a legal matter. It's a policy decision about what's going to allow you to get to the vaccination rate that you're looking for the fastest and have an environment that's conducive to education and public health. And I think understanding what the FDA timeline likely looks like, that they're making this decision, and I will have an update later this afternoon. But it's not just LSU. I mean, this is all of higher education in Louisiana that is approaching this, it appears, from this same angle. And I'm not going to involve myself in that decision. I will support that decision, but I do look forward very much to the day that full licensure is granted.
Okay. Dewana from Zachary asks if we're going back to phase one, and there are a lot of questions about whether this is going to end up in shutdowns or curtailments of business.
Yeah. Well, I have no intention of doing that. I have not been requested to do that. That's not a CDC recommendation. It's not anything I've received from the Office of Public Health. And I will point out that the least onerous thing we can do in order to try to curb transmission and give some breathing room back to our hospitals is to reinstate the mask mandate. Because if you notice, we didn't close any businesses, we didn't limit any hours, we didn't say that you're limited to a certain capacity. It doesn't apply to anything outdoors. And so this is a very targeted and limited approach that we believe will be effective. As you know, the mandate became effective today. It will be in place through September the 1st. We'll reevaluate as we approach September 1st as to whether to continue it. But we're not looking to have any additional restrictions placed on businesses and so forth. And I'm hopeful that we won't have to. But we do need compliance because we know that it works. This is not theoretical anymore. We've done it here in the state previously, and we know that masks curb transmission, and that needs to happen now because we have the highest growth rate of cases in the country. Our percent positivity of tests reached 15.4% today. That's up from 13.2% previously. And when you have increasing percent positivity, you have no reason to believe, in fact, you have every reason not to believe that you are approaching your peak in terms of cases. And that's going to drive continued hospitalizations and, Peter, deaths as well. 59 deaths reported yesterday, 44 more today. That's 103 in 2 days. A month ago, we were reporting like 2 a day.
Yeah.
You know, and so I mean, this is very serious, and the capacity at our hospitals is just absolutely strained, and it's a staffing issue. And so we have to give a break to our hospitals so that they can render life-saving care, not just for COVID patients, but for all of their patients.
Yeah. Here's from Jolie in New Orleans. I have jury duty, and I'm concerned about being around unvaccinated people. Why do I have to be forced to be around unvaccinated people?
You know, I have not heard anything from the Supreme Court or the judicial branch about any changes that they're making, and I'm not going to get into whether they should or shouldn't. I'm just going to ask her to direct that question to the point of contact that should have been on the summons. And the judicial branch is a separate branch of government, and
they remind you of that periodically.
Well, they do, but it's appropriate. Statutes have been passed that give them more authority to do things on their own without having to rely on any of my executive orders. And so I don't want to preempt any decision that they might be making or anything that they might have under consideration.
Okay. John of Leeville says, with the reluctance of citizens to take the vaccine, since most COVID illnesses last only a few days, why not simply let the vaccine run its course and move past this in a few weeks?
Let the
vaccine, I think they meant let the disease run its course.
Well, how long is that going to take? We've been in this 18 months. It hadn't run its course. And in fact, the current Delta variant is much more transmissible and more virulent than previous forms of the virus. And there is no running its course. We have people who are positive now for the third time. And so vaccinations are absolutely critical if we are going to end this pandemic and if we're going to slow transmission. A vaccinated individual is 8 times less likely to contract the disease, 8 times less likely, 25 times less likely to be hospitalized or to die. And our hospitals are full today. We don't have the staff to take care of people today. So this idea that we let it run its course, how many people would die, COVID patients and non-COVID patients alike, if that were the approach that we were to take? And that is not a recommendation that any reputable epidemiologist or scientist or anybody else is making. And that would be, I think that would be an absolute failure of leadership at all levels if that were the approach that we took.
Okay. Mary from New Orleans says, with the COVID variant affecting so many children, why start school now? Why not delay school?
Yeah. Well, the recommendations from the CDC and the American Academy of Pediatrics are such that when masked, 100% masking, vaccinated and unvaccinated, and by the way, there are no children under 12 who are vaccinated, right?
Yeah.
Only about 13% of kids between 12 and 18 are vaccinated. But masked students can safely be at school, and there are lots of reasons why we want kids at school, to include not just their education. And if you saw the report released by the Department of Education this week, we know that kids do much better in terms of their education if they're in person as opposed to participating virtually. But you also have social and emotional wellness. You have things related to nutrition as to why those kids need to be on campus. And secondly, if you don't have kids on school when it's scheduled, then you have a lot more people who can't go to work because their children are at home when they weren't supposed to be, and that would actually have an even worsening effect on our capacity with respect to nurses and other healthcare professionals in our hospitals. So we're looking at the recommendations of the CDC and the American Academy of Pediatrics to have school in place in person and masked.
Yeah. Martha from Harvey says, why don't you mandate home personal health care staff to get the vaccine? And I guess maybe to extend the question a little bit, what's your view of what different hospital groups are doing in terms of mandating employees to get the vaccine?
Well, first of all, there is a difference between approaches, generally speaking, between private employers and state employers. And while I am not saying that those public entities that are requiring vaccinations are acting unconstitutionally, what we know is that the Constitution is not implicated when a private employer does it. And so I support what Our Lady of the Lake did. And if you look at the timeline that they have for their employees to come into compliance, I believe that the vast majority of employees will choose to do it, and it'll happen about the same time as full licensure is granted to the vaccine under any circumstance. But I believe that the folks at FMOL take their responsibility to have a safe environment for their staff, but also for their patients and their visitors, and they understand just how efficacious the vaccine is in terms of promoting that safety and on their campuses. So I support the decision that they made, and hopefully people will not wait. And by the way, whether you're an employee of a healthcare facility or not, nobody should be waiting right now to get vaccinated. And that is some of the good news, because we have over the last few weeks a 300% increase in the people who are being vaccinated daily. We're nowhere near where we need to be, but we are gratified by the increased uptake that we're seeing daily in terms of people being vaccinated.
Do you know that raises the question, do you know at the higher uptake of vaccine rate that we're at now, how long would it take at this rate of people showing up to get to whatever the percent is that was the national goal?
Well, the national goal is to get everybody vaccinated, and certainly you don't have to have everybody vaccinated to really slow transmission and reach that so-called herd immunity. But we're nowhere near where we need to be right now. As I mentioned before, 37.1% of our total state population is fully vaccinated. It's about 43% have had one shot. The good news as we sit here today is about 82% of those people who are 65 and older have had at least one shot. And thankfully, at least up to this point, in this fourth surge that has been the worst by far of any of the previous surges, we're not seeing the same effect on older people, including in our long-term care facilities, because of the very high percentage of those individuals who have been vaccinated, and that demonstrates both the safety and the efficacy of the vaccines.
Yeah, that's a good point. Chris from Lafayette says, what about requiring proof of vaccination or a negative test to enter large events like Saints and LSU football games?
Yeah. I think you're starting to see some of that put in place around the country. We don't, and I think colloquially they're referred to sometimes as vaccine passports. Yeah. We're not entertaining that here in Louisiana, but we do want people to be vaccinated. It is incredibly important. We do need people to be tested if they've been exposed, if they have any symptoms. And remember, there's certain things we should always do. Stay home when you're sick. If you have a symptom, get tested. If you've been exposed, make sure that you're tested. If you test positive, make sure you're going through the isolation. If you're close contact and you need to quarantine, you need to do that. There's all sorts of things that people need to be doing. But we are not looking at implementing a vaccine passport in Louisiana.
Yeah, okay. This comes from Susan in Youngsville. The mask mandate from earlier was never enforced. Are there any plans to do so with the new one?
Yeah, well, the enforcement provisions in this order, this proclamation, are the same as in the previous proclamation. And look, this answer may not be satisfactory to some, but when you have 4.65 million people in your state, tens of thousands of businesses, these indoor venues that people will congregate in public, you're not going to enforce your way through it. Now, we have put out guidance to all the business owners. It's on Open Safely, and it was sent out to 35,000 businesses. We will respond to complaints and remind employers what the responsibilities are. And if warranted, we will issue citations. But the fact of the matter is we need people to comply and understand we all have a role to play. We can't just simply say, well, the hospitals just need to increase their capacity. Well, we can't snap our fingers and create nurses and respiratory therapists overnight. We all have a role to play to slow transmission, to reduce case growth, to reduce hospitalizations and deaths. And they are two things right now. The two primary tools we have are vaccinations and masks. And masks are incredibly important given just the extreme amount of COVID in our communities and the fact that it's now at least 90% the Delta variety, which is more transmissible and more virulent.
Yeah. This comes from Jim in Baton Rouge. Given the pandemic is a political issue, how about inviting politicians to spend a few hours in our overwhelmed hospitals and see firsthand what the medical staffs are up against?
Yeah, well, first of all, that would be a good idea for those people who do take a political approach to this, which, by the way, I just do not understand. I promise you, Peter, that virus doesn't give a damn whether someone is a Republican, a Democrat, or an independent. And the idea that there's any philosophical or partisan approach to managing a public health emergency such as this, a pandemic of a highly contagious and deadly virus, it just totally escapes me. And how people are so dismissive of science and medicine. And the experts who are out there making recommendations about preserving life and the ability to deliver life-saving health care in our hospitals. You know, it is confounding and it is sad and ultimately it is dangerous. The good news is I believe that more and more people every day are making the decision, in fact we know this, to be vaccinated, and I think they are taking the virus more seriously. This idea early on that there's nothing, you know, more than the flu or whatever, you heard all that, you know, more and more people are rejecting that and I think are becoming more reasonable and they're opening their minds to the reality of the situation, and I wish that was universally the case. It is not.
Yeah. Where do you personally, I mean, you're not a doctor, so where do you personally, who medically advises you, and how, to what degree have you talked to people who are actually, you know, in hospitals treating the disease?
Well, it just so happens that yesterday I had a Zoom call with the medical directors of every Tier 1 hospital in the state of Louisiana. I did that last week as well. But I routinely talk every single day to Dr. Joe Canner, the Office of Public Health. I rely on conversations that I have weekly with the White House task force looking at this, and could be Dr. Fauci or Dr. Walensky. I personally review CDC. For example, the last Friday they put out their morbidity and mortality weekly review that had the information out of Massachusetts that showed that while the vaccines are efficacious as advertised in preventing severe disease, hospitalizations, and death, that those people who did contract the disease were also contagious, and to a degree that mirrored those who were unvaccinated, which informed our decision to go forward with a mass mandate this week of both vaccinated and unvaccinated. And it was further corroborated by reports out of Wisconsin and Singapore. And I personally look at all of those things and try to avail myself of the absolute best people. And I think if you look at the press conference we did Monday and the array of doctors who were there, chief medical officers for their hospitals, and then Dr. Klein, the pediatrician specializing in infectious disease out of Children's Hospital, you know, they make an absolute compelling case for how serious this situation is, what we need to do in the short term to get our numbers down and save people's lives, but also the fact that we all need to be vaccinated.
Okay, I promised I would keep it to a half hour, so we have one last question, and this is from Smiley, who's survived COVID and lots of other things.
Well, I'm glad to hear from you, Smiley, and
So-
I'm very happy to know that you've survived and doing well.
He says, if masks prevented politicians from talking, are there any politicians you would order to wear a mask?
Well, you know, there are some politicians who I think that need to close their mouths and open their minds, and respect science, and you know, do things that are actually constructive in terms of promoting public health and so forth. But I'm going to decline to name names. As tempting as it would be, I don't know that it would be helpful. I am appealing to everybody, no matter what decisions they have made up to today about wearing a mask, getting vaccinated, whether they have been spreading misinformation, whether they have been intentionally undermining public confidence in these common sense proven measures. Today is a new day. And I don't care who you are, I'm asking you to reevaluate your position, be constructive, and base your decisions on science and on the public good. And if we will all do that, we're going to come through this faster and better with fewer people dying. And that should be our goal. And by the way, you won't have as long or big as impact on our economy, on people's livelihoods, and so forth. So I'm appealing to everybody, and then I'm also appealing to people to lift up our state and our people in prayer.
So, okay, well, I appreciate all the time you've given us. It's good to see you again. Maybe this will be the last time we do this about COVID. And we also appreciate the support of AARP and your staff for setting this up. And so thank you very much again.
Thank you so much,
Okay.
Peter.